Hi there. We will be talking about lips today, the aesthetics, and what can be done to improve the shape of the lips as well as the smile of an individual. There are various procedures that we'll be going through regarding changes in the width, the thickness of the lips, the width of the smile, the type of the smile, and so on and so forth. Let's first talk about the basic aesthetics of the lip. The lips, as far as the aperture, as far as the total width goes, should be as wide as about the eyebrows, which is a little wider than the distance between the eyes. So they are about, it's about 1.3 times the width of the eye should be the ideal width of the lips. However, some people like much wider lips and they look nice on them, and some people like fuller, smaller lips. The next thing that one has to consider is the width and length of the lips. The upper lip is usually a little smaller, little less thick than the lower lip. The lower lip should be again about 30% bigger than the upper lip. Now, there's no rule as to that, but generally, when lips are natural, the lower lips are usually wider and thicker than the upper lips. Now, the corners of the lips are also important. If they are going up a little bit or neutral, they look happier. If they go down, they look a little unhappy. That can happen with age, and with some people, it just happens because of the hereditary shape of the lips. So the corners, the lips themselves. Now the shape of the lips. This part is called the Cupid's bow, and it is, as can be seen, shaped like a bow. And the exact degrees to which the bow increases or decreases from side to side helps in shaping the lips and making them look nicer or flatter. So a more curvy lip is often supposed to be better, at least for ladies. For females, it's supposed to be more aesthetic. Now, depending on the shape of the lips as well as the muscles that move the lips, the smile can change from a person to person and for the same person as well. So the smiles, there are many classifications of smiles, but the ones I commonly encounter in my practice and people want to get improvement for are as follows. The first smile that people often see is the gummy smile, and lots of gums are seen. And while a man's smile should not show any gums and about maybe two-thirds of the teeth, a woman's smile can show a little bit of gums and still look very nice. A woman's smile ideally should show all her teeth, the entire width, the entire height of the teeth, as well a little bit of the gums. For a man, gums should not be seen at all, and the teeth should ideally be about two-thirds, maybe a little bit more or less. That is as far as the amount of teeth show that is appropriate. Now, if it is too much, it's called a gummy smile, and sometimes, even for women, so much of the gums can be seen that they do not like it. So that's a gummy smile. Then there's another kind of smile that is edentulous, like this. You don't see the teeth at all, and that looks like an old man smiling or kind of a forced, controlled smile. So that is like this. So gummy smile, and then you have the edentulous smile. Then sometimes people have what we call like a canine smile, that the lips rise up here and the middle part kind of stays back down. So it's like almost like a snarling smile. That also can be improved, but that is one of the other common smiles people don't like themselves. The most common smile that people like a lot and people would prefer to have is a Mona Lisa smile. Mona Lisa smile is when the corners go up and there's a gentle smile on the lips, and the smile does go up to the up to the eyes, and there's a smile that you can see through the eyes also. So even if the face, the mouth was covered and the eyes could be seen, one could see that there is a smile going on. Then there's a polite smile. The polite smile is smiling with the lips, but the smile never reaches the eyes. So it's like social smile. Then there is the Cupid's bow commissured smile. So that's just rising at the corners. That's it. The rest of the face doesn't smile much. So that is as far as the smiles go. Now, there besides dissatisfaction with the smile, as far as the static part goes, the lips can look either too big or too small. There can be too much space between the nose and the lips, and they can be too wide or too narrow. The things we do often modify in cosmetic procedures are the width, the thickness, as well as the dynamics, how the muscles move. So let's first start off with the thickness of the lips. That is the most common thing that we change, is thickness of the lips in terms of making them thicker. Lots of ladies nowadays want thicker lips, and we can use either fat or we can use fillers which are available commercially to fill in the lips and make them look thicker and nicer. When we do fillers or we do fat, it is important to define exactly how much we are going to be putting and what kind of shape we are trying to achieve. The first thing that I usually do is have a detailed consultation with the individual, do a little morphing to see what they're looking for, and then slowly, with them looking on, as far as fillers go, while they're looking on, we slowly modify the lips and the smile. The first definition is this white line, the line between the lip and the skin above. That white line definition is very important, and sometimes we enhance it. We even enhance the cupid's bow to make it a little more aesthetic, a little bit higher. The next thing we do is increasing the thickness of the lip overall if needed. And this little nub here, this little notch here, sometimes people want this to be a little bit more prominent, and we inject a little bit of filler right there. Then for the lower lip, we do the entire lower lip enhancement, but the most important part are the two sides. And some, or maybe many of the ladies wanted like a tulip, which means like a raised part on both sides and a little bit of depression in the middle, like two hillocks and a little valley in the middle. So we do that here and here, and then let the lips become more like tulips, or little hills, as I said, between with a little valley in between. On the corners, we usually put a little bit of filler so that the lips look happier. Instead of going down, they go a little bit up. We do the same things with the fat. The only thing with the fat is the amount of fat that stays behind is a little less predictable, and we have to do a guesstimate or guess as to how much is going to stay behind. The usual amount is about half of what you put. So again, the shaping is done the same way as a filler, and the fat is put in and reassessed in a couple of months. After filling, the other thing is lip reduction. When some people have very thick lips, they want to have them reduced to look more aesthetic. Very often it is the lower lip, but it can be both the upper and the lower lip, and occasionally just the upper lip. The reduction of the lip is done through the inside of the mouth, right down there, so that nothing is seen. And the cut that is there is done is inside the mouth, over the inside of the lip. A calculated amount of mucosa is cut, and some of the small salivary glands that are just beneath the skin are also either cauterized or removed. After some of the subcutaneous fat and glands are removed, the mucosa is brought back together, and you get a nice lip reduction. The amount of lip reduction and the shape is calculated before we do the procedure. The same thing can be done for the upper lip, and the incision is again in the mucosa inside of the mouth. So that is lip reduction. The one thing that we sometimes do is cheloplasty, or a little lift on the corner of the mouth. When older people especially have sad looking mouths, the corners going down, we make a very small triangle and lift the triangle up. One has to do it very carefully and not go too deep, otherwise the scarring can be more visible. So just a very small cut here, lift the corner up, and it just gives a nicer smile. That is usually done for older people who have these marionette lines. We also do some fillers for the marionette lines to improve the lower part of this droop. The next thing we do for the lips is lifting of the upper lip, and that is called a lip lift. We make a small cut here right beneath the nose, in the shadows of the nose, and the lip is lifted up the same way. So these are the common procedures we do for the lips. Sometimes, of course, we do things like reconstructing small parts of the lip, some cleft lips, some cysts in the lip, but those are more reconstructive in nature. As far as cosmetic procedures go, we improve the corners, we improve the bulk of the lips, decrease the bulk of the lips, or lift the lips up. Those are the common things: augmentation, reduction, change of shape, and so on. Now, as far as the smile goes, sometimes the smile is such that it needs minor modifications. When it is a very gummy smile, a small amount of Botox can be injected to decrease the pull of the muscle, which lifts up the lips too much. Similarly, with a canine smile, with the center, this part of the lip, the middle part of the lip, not this part, but the middle part of each side kind of goes up and gives like a canine, like a dog like smile. That kind of canine smile can be improved with a very small amount of Botox again, to decrease this muscle from lifting the lip up, preferentially at that place. Similarly, very small amount of Botox can improve some of the other smaller parts of the aesthetics of the lips, both for the upper as well as the lower lip. That's another way we can modify the lip shape and the dynamics of the lip. One other thing we do is lip reduction non-surgically, for which I use invasive radio frequency. We put a probe inside, and that gives out radio frequency waves that tend to decrease the bulk of the lip, and that can be done without a cut. And some people prefer that, although the amount of reduction is less with this than with the surgical reduction. So those are the few things I could think of in terms of what we can do about the lips and how we can modify their shape. Any questions or queries, please don't hesitate to call us or send us a mail.